Hi everyone, I'm Salva, a final year medical student, and this is my very first video where I'll be teaching key concepts in medicine, just the way we need to know it for the university exams. We all will be in the last stage of the university exam and we don't know what to read, how to read, and we just want something very concise. Here I'll just try to teach everything concisely, and you can just grab some points, listen to some points, and just reproduce in your exams and just pass your internal assessments and your university if possible. So let's start. First, I'll be starting with the toxicology series, and then I'll go for the other systems as you request. Now, first, I'll go with the snake bite because this is a medical emergency, first of all. And next, this is the most important long answer we all get in our university exams. We have read this already in forensic medicine, but yet we might have forgotten. That's why we are here. So let's start. So, first is snake bite. For snake bite, first you have to know the three families and this name of the snakes which are present in each families and what are they neurotoxic, hematotoxic, myotoxic. We'll just know about it. So first is Elapidae. It has two snakes, cobra, crate. If you're talented enough, remember mamba and coral snakes. These are neurotoxic. You have to remember this no matter what. It acts on the peripheral neuromuscular junction and inhibits the nerve impulse. And you have to remember two toxins, presynaptic neurotoxin and postsynaptic neurotoxin. Presynaptic neurotoxin is beta bungarotoxin and postsynaptic neurotoxin is alpha bungarotoxin. Presynaptic, so it will interfere with the release of acetylcholine, whereas postsynaptic inhibits the acetylcholine from binding to the receptor. Next, the snakes present. Crate is an example of having presynaptic neurotoxin, and cobra is an example of having postsynaptic neurotoxin. Next family is Hydrophidae. Hydrophidae, the name hydro shows sea snakes. You can easily remember. And these are myotoxic. Just remember, you require your muscles to swim, so they are myotoxic. It causes local tissue necrosis and rhabdomyolysis. Next family is Viperidae. What are the snakes present? These are viper and pit vipers. The name itself says viper. And what do they cause? They are mainly hematotoxic, cause renal failure and local reaction. So, being hematotoxic, it has three things: hemorrhagens, procoagulants, proteolytic enzymes. Hemorrhagens causes vascular leakage and bleeding, procoagulants causes DIC, and proteolytic enzymes cause local tissue necrosis, coagulation defects, and organ damage. So let me summarize this page. There are three families: Elapidae, Hydrophidae, Viperidae. Elapidae, cobra and crate, they are neurotoxic. Hydrophidae, sea snakes, they are myotoxic. Viperidae consist of vipers and pit vipers, and these are hematotoxic. Now, we have to know about the differences between two snakes, venomous and non-venomous snakes. So, this is an rough diagram showing you how a venomous and non-venomous snake looks like. There are some key differences which we have to know. First, we'll look at the head. The head has large or small head scales and has a triangular head. Whereas, in a non-venomous snake, large shield is present in the head and a large dorsal scale is present. Next, we have to look at the pupil. It is very characteristic here. It has vertical slit-like pupil in venomous snake, and in non-venomous snake we can see round pupil. This is one characteristic difference. Next, head of the non-venomous snake is round body-like, whereas this is triangular. Next, there is no fangs in non-venomous snake, and fangs are present in the venomous snake. Like pupil, this thing is also very characteristic. Then, here, the jaw is uniform and has small teeth present. These are called small hooked teeth. And the tail is flat in venomous snake, whereas in non-venomous snake, it is cylindrical or blunt tail. Next, since the venomous snake has fangs, when it bites, the fang marks are present. Whereas in non-venomous snake, when it bites, multiple puncture marks due to the small hooked teeth will be present in the hand. Now, the color of the venomous snake can be bright, whereas of non-venomous snake, it is not that bright. And small ventral scales are there that do not cover the belly, but it is present all around except the belly. Whereas in venomous snakes, large ventral scales covers the belly. So we'll look at the key differences. I'll summarize it. First, in venomous snake, we have to look the head. The head is triangular in venomous, and in non-venomous, it is round. Next, there are large or small scales in venomous snake, but in non-venomous snake, large shield is present in the head and large dorsal scale are also present. Next, The fangs are characteristically present in venomous, whereas in non-venomous, small hooked teeth are present. Whereas the pupil of the venomous snake has vertical slit-like pupil, whereas in non-venomous snake, there is round pupil. There is flat tail in venomous snake, and in non-venomous, cylindrical or blunt tail is present. The color is bright in venomous snake, and non-venomous snake, it is not bright. And ventral scales do not cover the belly in non-venomous snake, whereas in venomous snake, large ventral scales are present. This is what you have to know. This is enough. Next, in clinical features, I have divided this into two types. Systemically, we'll be seeing it later. Now first, we'll see family-wise. So, I've already mentioned that Elapidae, main two snakes which you have to remember is cobra and crate. In that, they both are neurotoxic. So, they cause local pain and swelling. It happens in all the snakes. Like whatever snake bites, everywhere there will be local swelling and pain. So, since this is neurotoxic, mainly it causes paralysis, ptosis, then slowly the palate and jaw, tongue, everything will be involved. Next, the neck muscle will be paralyzed. Slowly, the respiratory muscles will be paralyzed and the patient will die. Next, this is in case of all the neurotoxic snakes. Whereas, characteristically, the crate has no pain and no swelling. And the patient's face becomes red. So, it is called goose flesh like appearance. And there is heaviness of the eyelid, blurred vision, diplopia, red eye, hypersalivation, and vertigo, dizziness. Next, we'll look at viper. Viper causes local and hematotoxic effects. Local swelling will rapidly spread. It will cause bruise, blistering, and necrosis, and there will be bleeding from the bite site. It can cause epistaxis, hematemesis, hemoptysis, subconjunctival hemorrhage, and cutaneous bleeding. Slowly would lead to hypotension and shock. In ECG, we can see arrhythmias that would lead to acute renal failure within 7 days. Sometimes it can also lead to acute pituitary failure and cause death. Sea snakes are myotoxic. They cause muscle pain, weakness, rhabdomyolysis, and lead to hyperkalemia. These are the clinical features based on each family. Next system-wise. In CVS, effects are hypotension, shock, arrhythmia, pulmonary edema. In CNS, paresthesia, ptosis, ophthalmoplegia, respiratory paralysis. In hematological, hemolysis, bleeding, decrease in the platelet count, DIC, which will also lead to renal failure, and in muscle, pain, tenderness, myoglobinuria, which could also lead to renal failure. If there is renal failure, there will be hematuria, hemoglobin in urine, myoglobinuria, loin pain, renal failure. Endocrine effects are acute pituitary or adrenal insufficiency. You can remember the either way. I prefer remembering it within the family. That's easier. Next, we have to know about the investigation. First being blood investigations, total leukocyte count is increased, anemia due to bleeding, and viper bite can cause thrombocytopenia. We saw it before. Next, in urine investigation, black urine, pink plasma that suggests intravascular hemolysis. We have to check for RBC, RBC cast, protein, and myoglobin. Next, bleeding time, clotting time, and then platelet time. In this, if it is more than 20 minutes, then there is no coagulation. We have to check for fibrinogen degrading products. Next, in renal function test, we have to check for urea, creatinine, and electrolytes. ECG, sinus bradycardia, ST and T wave changes, and specific snake venom antigens are seen. Creatinine phosphokinase is increased in sea snake bites. Now we'll go for the treatment. So we have to divide it into two parts: field management and hospital management. Field management, it is the area where you find the patient with the bite. Now you have to first immobilize the limb. You should never move the limb where the snake has bitten. You have to apply pressure bandage only in elapid bite snakes, that is cobra and crate. It can be a creep kind of bandage or elastic bandage. But what is the disadvantage? Since if you are trying the bandage here, the blood flow is just stagnant over here. So this can lead to localized necrosis of the limb. Next, we have to follow right rule. R stands for reassure the victim, I stands for immobilize, G stands for get to hospital, H stands for hospitalization, T stands for telltale the symptoms and signs to the doctor. We have to explain everything to the doctor. Next, hospital management. We have to take the vitals, administer anti-snake venom. Anti-snake venom is of two types, monovalent and polyvalent. Monovalent is against a particular species of snake, whereas polyvalent is multiple species. In India, we use polyvalent anti-snake venom. Now, first we have to give test dose 0.02 ml of saline diluted anti-snake venom. We have to give it intradermally, and after 10 minutes, we have to observe for any reaction. If there is no reaction, we have to give the anti-snake venom. If the patient becomes allergic, we have to give IV antihistaminics like diphenhydramine with steroids. And we have to further dilute the anti-snake venom, and we have to administer it slowly. Now, we have to make sure that there is adrenaline injection nearby while administering the anti-snake venom, because there is a risk of anaphylaxis. Now the dose. If local reaction at the site is present, we'll give 5 vials. If there is local reaction with severe cellulitis, we give 5 to 15 vials. In severe reaction with systemic envenomation, we give 15 to 30 vials. Initially, first we give 8 to 10 vials IV over 1 hour plus 5% dextrose or normal saline, and the rate is 5 to 10 ml per kg. If there is neuromuscular paralysis, we have to give neostigmine 1 mg IV stat with atropine 1 mg IV, half hourly, 2 hourly and 4 hourly. Let me summarize everything in short. First, you have to write about the major families of snake, Elapidae, Hydrophidae and Viperidae. Next, you have to write the clinical features, either systemic wise or family wise, mainly focusing on the neurotoxicity, hematotoxicity and the myotoxicity. Next, the investigation, simply divide it in complete blood count, urine, bleeding time, clotting time, renal function test, ECG. For the treatment, you have to classify as field management and hospital management. Field management, never forget about immobilization of the limb and the right rule. Next, for hospital management, don't forget the word anti-snake venom and the types of the anti-snake venom and how much test dose is given, what to do in case of an allergy and what to do if there is no allergy. And the dose, how many vials are given when there is minimal, mild, moderate and severe reaction. Next, for neuromuscular paralysis, we should give neostigmine and atropine. I hope you all find this video useful. If you find it useful, do subscribe and hit the bell icon, and we'll be posting more videos like this to help you ace the university and your internal examinations. Thank you.